Please note down the Asia Pacific Association of Cataract and Refractive Surgeons meeting for the first time is coming to India in Jaipur, November. And we have stellar faculty in terms of Bob Sioni, Warren Hill, Alan Crandall, Roger Steinert, and so many other European coming. So please take the opportunity. It's coming for the first time. But I also want to let you know that I do receive research grant support from Alcon Laboratories. Now that we learned, we are ready now to offer and consider various customized solutions for our dear patients.
हेलो मास्टर जी, हॉटर पोर्टेबल मास्टर नेक मेरे को चाहिए स्ट्रेट हार्ट शेप का। कुछ याद है रानी ने कुछ एक मूवी में पहना, कुछ थोड़ा नेट, कुछ थोड़ा चिकन, कुछ आप मुझे बैक, कुछ एक ऐसे क्रिस क्रॉस करके कुछ चोरी दे दीजिए, कुछ पे ना 3 इंच रखना, कुछ मेरे को टैटू शो कुछ ना, कुछ
Well, of course it's possible and made for use. Madam or sir, IOLs is possible, and I recognize my co-author, Dr. Leda Sastry, in this presentation. But can't be enough how other experts have studied that understanding the patient, understanding the eye, will help you to customize and give an appropriate solution. And I'm using 4 different real cases we had, and we have many of these, and you all have that. So you may tune with all 4, some of these cases. We all have such situations. Like this person, very successful businessman with bilateral cataracts, and he leads very active lifestyle and is full of energy. He needs to read and write, but he's like me. He's not very techno-savvy. Doesn't understand much computer. And he has variety of reading glasses at different places, as I do I have 6 sets of glasses. But he's managing. Although he expressed a desire that I wish one day I can get rid of these reading glasses or don't have to manage. Well, in that sense, he had an average visual requirement. He was not very fastidious, as you could see his lifestyle, and fairly decent understanding individual. But he had to drive at night because he lives in metros, and he had come all the way to Ahmedabad, and he had to do that. Well, the aberrometry profile was okay, and we thought that we can consider him for giving him a range of vision. So our advice was then restore +3. But when I say restore +3, I want to recognize that this restore is because I use restore, but all other lenses, the Acrylisa, the Technics, and many others all have, at the moment, except the one lens I'll discuss later, has +3 add or +3.5 add. All of these are same group. So you can interpret in your mind whatever lenses it is representative lens here is restore +3. So that lens, and we discussed the trade-off and possibility of glare and halos because he had to drive at night. Well, he had a decent postoperative, well-centered restore with minimal glare and halos. So what we did here by putting this +3 add and similar of these other lenses, multifocal, that we improved his lifestyle, and being a business active man, he's happy that he didn't have to have those multiple pair of reading glasses at various places, and he really now appreciates a better quality of life. So what we are trying to tell here in this example, and what he taught me, that although he was a driver at night every day, a forthright discussion and counseling did allow him to adapt to that, and he anticipated, his mind was prepared, and he could neurosensory adapt, as Dr. Ramamurthy said, quite easily because we had a good chat, and he was a fairly good personality with good understanding. So you can try, and as DR tried in those angle alpha also. So it's something you need to try and customize in each individual. But it also means that these group of multifocal lenses with 3 and 3 add is a good option where you need a range or flexibility in your range of vision, but they are not very precision-oriented because we recognize that all these multifocal lenses do not give a precise or a crisp vision for all the three: distance, intermediate, and reading vision. So you can consider in these group of patients that +3 add. That's what he taught us. But also for those who do not want to look for that precision, also you can consider these kind of multifocal lenses with +3 and +3.5 add. Now this is another scenario, a radiologist who came from Madhya Pradesh and who had a very excellent, technically speaking, cataract surgery done, and he was unhappy mainly because he had a residual -1, 2.5, and he expected, and he told the surgeon that I don't want to wear glasses for distance most of the time. So he was a little bit unhappy, and he wanted this time a good distance visual performance, at least doesn't mind reading like gauge. Now, at that point, I go back, you can consider a monofocal lens with a different combination with monovision, but all of them will not give that crisp vision for distance, because you will then end up with intermediate problem and reading problem. But that's something you can consider if you're not familiar. But this is the lens I want to introduce to you, those who are not familiar. It's not 3 add or 3.5, but add is 2.5 add. Can you ask him not to stop? And this is what we are discussing here, a complementing visual strategy with other fellow eye. And what we did then is that we did 2.5. And 2.5 is a distance-dominated IOL with added intermediate capability, but will always need a reading aid and extra light. So when we did that, his binocular unaided performance, what he wanted, no glasses, was very good, 6/6 part, because of the new second eye 2.5 restore. And he could continue intermediate vision with both eyes, because -1, 2.5 in the previous eye gave him an intermediate vision. And this 2.5 not only gave that intermediate, but also distance vision, so he was on the moon. And he was ready to accept the reading vision was 1.25 with both eyes because of the previous myopia in the fellow eye, and with 2.5 needing typically 0.75, 1.25, or at the most 1.5 diopter. So here is an example where, for his personal preference of his no vision, no glasses for distance, we adapted 2.5, but also it serves its professional requirement because he's a radiologist, and you can see him seeing the X-ray plates or this kind of imaging software on the screen. He could do that very well. So this is a combination situation, and that's what that 2.5 can be paired with a monofocal lens in the other eye. And of course, the other eye refractive status would play a decisive role, as has been hammered upon very well. But it's also great for those who look for precision, unlike the first +3 diopter group of lenses. Though those who need precision, this is an excellent lens. So this lens actually, to tell you, gives an excellent distance vision with a good intermediate vision, which the monofocal lens, IQ or any other, will not give it, intermediate. So this is, in my language, a modified monofocal lens. And that's what I tell patients, that this is a new lens which you can take it like a modified monofocal lens. What is that? Why do I pay more if it's monofocal? Well, this is the lens which will give you almost a distance quality vision like a monofocal, but something it gives which monofocal will not give you is the ability to read SMS, laptop, kitchen work, and you can watch television and at the same time read and write SMS without any glasses. So this is the lens. But remember, you need to have extra light and 1.5 at the most reading glasses. Would you go for it? Most of the patients use their distance vision and intermediate 80% of their life, 24 hours. So this is a lens which I'm finding so useful in my practice, and my practice has increased tremendously on multifocal segment because of this new modified monofocal lens. but they have to pay, and it is a multifocal lens, like any other multifocal lens. So this is a third scenario. A bank executive, it doesn't sit in the counters, but sit in the back, a managerial kind of executive, had a unilateral PSC category, youngish man, and had an active lifestyle, as you would expect. And because of his work profile, he has to use lots of computer, and banking now is computer-based these days. But his complaint was a glare when he drives, because he drives, and also while he works on a PC, and you can see these lights coming, and you find glare. I was seeing glare looking at this. So glare was an issue to him on a computer, and he had a hobby of motorbike scooters. You can translate that of 8-kilometer scooter every day, but he had a motorbike, saying we had to do this very carefully in this time because he had two different challenges here. His lens aberrations and corneal aberrations were of such a time, and this is what we needed to understand. We made sure, as has been told earlier, and we went through all that, and we then suggested him once again a unilateral restore with monofocal in the other eye, and we discussed the trade-off, and that trade-off is that we'll have a low-powered readers. But we were very confident in telling him that you will be able to ride your bike because this 2.5 modified monofocal or multifocal is very different than all groups of multifocal lenses, including Restore and all others, because the dysphotopsia in terms of the glare and halos to me, I never had any patient who really complained after 2 months. But maybe there is one or two, and that's because of the way the rings, the number of rings and separations. So you do not need to worry now when the patient comes to your consulting room, post a follow-up, you are finger crossed, unless you see his face and smile, maybe he will complain of glare and halo. You will not have to worry now with this lens. Practically speaking, no halos and glare, you can take it from me. So because he was a motorbike rider, but he was ready therefore, and we did customize, and he was then able to meet his professional as well as personal hobby and the needs and demands we could cater. So we could offer him the customized solution, taking his professional and his hobby. So take-home message, once again, 2.5 can be considered for unilateral implantation. And Restore 2.5 can be an option for even precision-oriented, as I showed you the gentleman in the picture at the end of the second presentation. The final case is a retired police commissioner, and these guys have a habit, like many of my MBA colleagues, just have a lot of time, do nothing, have a lot of money in their remuneration, unlike us who work hard, and have golf. And he wanted to play golf without glasses. He had a cylinder. And our advice, therefore, was to restore toric or any other multifocal toric bilateral. And he was very happy because he could play golf. He didn't care about anything else, but he did everything. So we could customize for his eye, for astigmatism, restore toric, and also his mindset. So that is it. But the best part in these offering this customized solution, it's not only meant for leaders, it is also meant for our Aam Aadmi, and they also can avail this strategy of offering IOL for you, sir, customized. So thank you so very much.